My name is Jeff. I'm in Albuquerque, New Mexico, and I care for my mother, who had a debilitating stroke about 3 years ago.
Hi, my name is Roxanne. I live in New Orleans, Louisiana, and I've been taking care of my parents for 5 years.
I think my biggest challenge as a caregiver is it is really tough to care for somebody who doesn't remember you anymore or have any memories that you share between the two of you from growing up and all those years together. When my mom got sick and had her stroke, I left a corporate job in Dallas and moved back to Albuquerque to help care for her, and I don't think that I understood at the time how emotionally draining it was going to be her caretaker full time.
My greatest challenge is, first of all, I live halfway across the country from my parents. I constantly worry about my parents being taken care of by the family that lives locally, and if that family is letting me know in a timely manner when my parents need something. I do have someone paid who comes in to support them throughout the week, and sometimes I feel like I get more context and update from the paid caregiver than I do from my parents. Because, parents, they don't want to worry you.
Hello there. I'm John Shaw, CEO of Caregiver Action Network. Today, there are more than 90 million Americans caring for a loved one in this country. Those family caregivers express the full spectrum of caregiving. Some are caring for an older loved one. Some are caring for a child with significant health care needs, such as autism. Some are caring for a family member, a friend, a spouse, or a neighbor with a disability or chronic condition, like Parkinson's or MS. The stories you heard just a moment ago were family caregivers sharing a bit about their role as a family caregiver and what impact they want to have on the persons they're caring for. In this upstream training module, we will go a bit more in-depth on why family caregivers matter. Not just to their loved one, but why family caregivers matter to you as the healthcare professional as well. I want to give some clarification on a couple of the terms because you'll continue to hear them throughout this module and the other 3 modules included in this series. When we use the term long-term care community, we're talking about a variety of settings, including nursing homes, skilled nursing facilities, and assisted living facilities. The term care professional is used to identify any and all staff at those facilities, including but not limited to medical staff, nurses, administrators, social workers, case managers, and patient and family advisory committees. Now, the mission for Caregiver Action Network, for me, is personal. You see, I am a long-distance caregiver for my mom, so I fully understand the challenges and stresses of ensuring that your loved one is well taken care of, even when you can't be there physically. We all face unique caregiving challenges when our loved one is living with us, living in a long-term care community, or living independently halfway across the country. There are day-to-day caregiving challenges and rewards that are universal and that span across all family caregiving experiences. Now at this point, I will be handing the presentation over to Jessica, who will be guiding us through the rest of this module. But before I turn it over, I'd like to recognize our sponsor, Omnicare Pharmacy, a CVS health company. Their support allows us to bring this information to you.
Thanks, John. Before I get started, I want to mention that this module is one in a series that can all be accessed at caregiveraction.org/Omnicare Pharmacy. The topics of the other coordinated modules include the needs of family caregivers, the critical role of family caregivers in the transition of care, and what family caregivers want, and how they can support the care professionals at long-term care communities. Now, let's jump in and take a closer look at why family caregivers matter. We started off by mentioning just a few of the many caregiving scenarios that exist across those 90 million family caregivers. The child caring for their aging parent, the parent caring for their child with a disability, the spouse or partner caring for a veteran returning home from combat. Regardless of the specific caregiving scenarios, family caregivers matter in much the same way. First, family caregivers and their loved ones are the only constants across all care settings. This means that while doctors and pharmacists and nurses may all change between shifts, the family caregiver remains a regular fixture and source of support for their loved one. My mom's diagnosis may change, and she may need to see a new specialist, but I'll always be there with her for appointments and to make sure she understands everything that the doctor is telling her. The phrase all care settings does include long-term care communities, and in a separate module, we cover the role family caregivers play in helping their loved one transition into long-term care. Because family caregivers are with their loved ones in all of those care settings, hospitals, doctors' offices, specialists, and their loved one's previous residents, it reasons that they would have a more personal knowledge of their loved one, who is now your newest resident. An example of this is medication. A family caregiver not only knows what medication their loved one has been prescribed for, let's say, high blood pressure, but they also know what they like to take in the morning with their coffee. A family caregiver knows that their loved one with Parkinson's starts to experience increased tremors during the afternoon, during, let's say, an off period, and that they sometimes need to adjust their daily routines or plans for the day because of this. So, while this may sound simple, it's the core of why family caregivers matter. They are one of the constants in the care team and provide support to their loved one in all care settings. They are also with their loved one daily, and so they have a more personal understanding of them, including preferences and routines. To get a more complete picture of these concepts, we need to look at what some of the things family caregivers do for and with their loved one, specifically supporting their loved one with activities of daily living. Some of these things are specific to when they are caring for them in their home, and likely now the responsibility of the long-term care community and the care professionals. We'll circle back to that shortly. Activities of daily living are a great place to start. When caring for their loved one, they are often the ones helping with toileting and showering. They are helping their loved one get dressed in the morning and put on their pajamas when it's time for bed. When managing such personal care of an individual, of course there are going to be preferences that not only make them feel more confident, but ultimately helps to build the relationship between care professionals and the resident. This can be as simple as knowing which way they may like to part their hair, or matching their socks and shoes. These next items fall in the category that family caregivers may consider daily life. Think of these things as kind of daily chores. Family caregivers are getting their loved one to and from medical appointments, taking them to their book club, church groups, or weekly card games. They are making sure the laundry is done, dishes washed, and bathrooms are clean. They are picking up groceries and cooking meals. These are all seemingly small routines that can ultimately have a massive impact. When small routines are thrown off, this can lead to agitation and other frustrations and roadblocks. For example, a family caregiver likely knows that their loved one is an early riser and likes to have their medication and coffee in time to watch their favorite morning show. Earlier, we talked about the more personal information a family caregiver knows about their loved one. The example being how a family caregiver knows not only what medications their loved one is taking, but knows how they prefer to take their meds. But medication management doesn't end there. Family caregivers fill the prescriptions at the pharmacy and discuss questions or concerns about medications with the pharmacists, such as side effects or potential interactions with other medications. They administer the medication, and yes, that does include injections. It's likely that they know the preferred injection site and how to put them at ease while administering. Family caregivers also coordinate multiple medications, which means keeping a complete and updated medication list. This recourse can vary in the form it takes, possibly digital or app-based, possibly a binder or folder. Regardless, coordinating the caregiver's documentation is a wealth of information and context that in some instances may not be reflected in transferred medical records. Family caregivers are extremely good observers of the side effects of medications. They also know which meds did not work in the past. The work of managing multiple medications can be difficult, but is crucial. Medication mishaps are one of the leading reasons that seniors end up in a hospital or emergency room, so it is important to have all of these details clarified. Additionally, the mismanagement of medications, particularly for those individuals taking more than 4 prescriptions, is a leading cause for falls among seniors. Having this context can often save you some steps along the way, and also improve the resident's experience and quality of care. Now, one of the more challenging tasks of caregiving is medical procedures. These examples are designed to give you an idea of the variety of medical procedures a family caregiver may be responsible for. Perhaps an individual has had surgery recently. They may require help with wound care throughout the healing process. Changing bandages or dressings regularly and monitoring wounds for signs of infection may have become part of a caregiver's daily routine. In addition to directly caring for any wounds, it may be part of the routine to observe skin around pressure points and to check general skin integrity. Emptying drains and monitoring fluid output may also become part of that routine. Similar to the injection example, it's likely that the family caregiver has their loved one on a schedule for this and knows how to best handle these procedures while keeping them comfortable. Procedures like these can be very personal, and taking into account the resident's preferences and routine will only serve to make your job simpler and avoid any possible agitation or conflict. Other types of medical procedures may include monitoring and reporting on vitals, such as blood pressure and temperature. A resident's weight may also be monitored as a sign of nutritional health. Other common medical procedures that may have previously been managed by a family caregiver can include catheterization and ongoing monitoring of vital signs. Understanding how they have approached the management of these tasks will help you tailor your approach and hopefully make your job a little easier. Now, financial management is an area of caregiving that is sometimes overlooked, so you may be asking, what items may be included here? First, there's insurance, from selecting a plan and keeping it current to submitting claims. Make sure that the family caregiver understands options, such as Medicare Part D and My OmniView. There's making sure medical bills are paid. This also means coordinating with the appropriate individuals in the billing department to address any issues or questions around bills. There's also scheduling and supervising home aides and making sure insurance claims or bills from these services are handled appropriately. Essentially, the core of financial management is keeping track of medical bills and ensuring they are paid on time. Some caregivers oversee all finances and will be responsible for making financial decisions relevant to your newest resident. It's also not unheard of that financial management will be delegated to someone other than the primary caregiver. Now, family caregivers have a vital role to play when their loved one is transitioning from their home, the caregiver's home, or a hospital into a long-term care community. When transitioning out of the hospital, the family caregiver participates in discharge planning, advocating on behalf of their loved one's goals, and communicating to their loved one what that discharge plan consists of. Regardless of where their loved one is living, the family caregiver is in charge of managing medical appointments with all providers, specialists, primary care, and therapists, which can include physical, speech, or occupational. A family caregiver's responsibilities may shift a bit when their loved one transitions to a long-term care community. Some of the items we discussed under personal care, including toileting, getting dressed, and bathing, will be handled by community care professionals. The same goes with housework or upkeep of space and meals. Although family caregivers may, for example, want to make sure that their loved one's favorite snacks are on hand for them. We discussed that one of the ways family caregivers matter is through their personal knowledge of their loved one. While they may not be the ones administering medications or doing medical procedures after their loved one has transitioned into a long-term care community, they can share that personal knowledge with the community's care professionals, so their loved one's wishes and preferences are being honored. It's possible that some responsibilities may not change. Financial management will still belong to the family caregiver. They will still be accompanying their loved one to appointments and keeping updated health records. It's important to do a level set so that expectations can be managed on both sides. So, we've reviewed a lot of different terms and scenarios in this module. Some that may be consistent with your day-to-day operations as a care professional, and some that may not. What's important to underscore here is that the language that you use to describe tasks and the language that family caregivers use may differ. These are a few examples, but what's important here is that the left hand is talking to the right hand. The left hand being the family caregiver and the right hand being you, the care professional. When communicating, it's often important to meet folks where they are and use language that they can relate to and understand. It's also important to take into account any language barriers, cultural differences, or even regional idiosyncrasies that may be at play. For example, we use the phrase family caregivers to identify anyone, family member, friend, or neighbor who is supporting a loved one. But not everyone fitting that description embraces that label and may go by something else: care partner, mom, dad, brother, sister, or spouse. There are other terms, but it is important to note that some of this may be influenced by culture. In closing, family caregivers do quite a bit more for their loved one than many of us realize. Hopefully, by breaking down the role of family caregivers a bit more, we've been able to show how integral they are to almost every facet of their loved one's care, and why they matter to you as a member of their professional care team.
Thanks, Jessica. And thank you for tuning in to learn a little more about why family caregivers matter, not just to their loved ones, but to those working with their loved ones as well. I hope that the information in the stories shared by family caregivers has given you a deeper understanding of what family caregivers do and the impact it has on their loved one's care.
You know, at their age, both my parents are struggling to remember things. Perhaps it's an early sign of memory loss. So it's becoming increasingly important for me to preserve our family history and the memories that live within my parents. Being able to remind them and relive those memories with them has created a special bond, a special dynamic between us. I've also found that sharing my parents' history and their preferences helps create a more meaningful, a more trusting relationship between my parents and their caregiver. To see my parents happy and healthy, that's the greatest gift that a caregiver can have.
I think the most rewarding thing is, just that I know my mom is being really well taken care of, because, she took care of me for decades growing up, and it is really nice knowing that she is in a facility that I really like, with staff that I feel like genuinely care about her and are taking good care of her, and that's something that really puts my mind at ease. It's a really hard situation to be in, and unfortunately that selfish part of human nature, I think it can be really easy to resent the person that you are caring for or the situation that you're in and get angry or frustrated. But my best advice would be, don't let yourself go to that angry place or become angry, and realize that you don't need to do this yourself. You don't have to do that. You don't have to be a hero and just try to shoulder all of the burden yourself. So enlist the help of professionals and family members, people in the community, and realize that you're not alone, and that this is a hard circumstance to be in, and that it is okay to ask for help. So please reach out and don't try to do this by yourself.
You know, you can't do everything by yourself. Don't be afraid to ask for help, whether it's from family or friends, or hiring an experienced caregiver, or looking into a long-term care facility. Just take a deep breath, do your research, and make some smart decisions. Everyone's circumstance is different. Figure out what your circumstance is and take it from there.
Be sure to connect with Caregiver Action Network on social media and visit caregiveraction.org to find more information and resources for family caregivers, including our Caregiver Help Desk, a tool that connects family caregivers with caregiving experts via phone, chat, or email to find answers to difficult questions and be heard.